This SimuLyve video presentation was created by MBM Productions International as a demonstration to highlight how to turn an ordinary PowerPoint into an engaging, contemporary, legally accurate and standardized educational broadcast that also supports your image and your brand. To produce a comprehensive adverse event film, our experts will first partner with your pharmacovigilance staff to create an approved script based on a PV-approved PowerPoint, which will then be filmed and then transformed into an adverse events SimuLyve video presentation. This presentation is not a complete adverse event course, but instead are excerpts. This video is being distributed through SimuLyve On Demand, a full-service learning management system that broadcasts video, tests learners, distributes supporting PowerPoint and other documentation, and provides pharmaceutical compliance certification to ensure a proper understanding of the educational material. SimuLyve, as the name implies, simulates a face-to-face, in-person experience. For us, the days of a mundane PowerPoint phone call presentation read in a monotone, bullet by bullet, are long gone, an outmoded form of education. SimuLyve, in contrast, utilizes well-honed contemporary television techniques, like you're seeing right now, no different than the BBC or CNN. Well-done interactive SimuLyve films available on demand are what today's busy healthcare professionals demand and deserve in their medical education. It's not webcasting, it's SimuLyve. Please enjoy the presentation. Hello, and welcome to the training module, Safety Reporting of Adverse Events in Clinical Trials. This course provides an overview of the safety reporting requirements that clinical investigators and sponsors must follow to ensure compliance with applicable regulatory requirements and standards. During this course, we'll discuss the following essential items: serious adverse event categories, reporting serious adverse events and follow-ups, guidelines for completing the serious adverse event form, guidelines for completing the pregnancy form, who to contact if you have additional questions about SAE reporting. Sponsors and principal investigators, PIs, have a joint responsibility to promote patient health and safety. To evaluate patient safety, it's critical to provide medically intelligent adverse event information. Sponsors monitor the adverse event information and share the safety profile based on regulatory requirements worldwide. According to the International Conference on Harmonization Guidelines for Good Clinical Practice, or ICH-GCP, the rights, safety and well-being of the trial subjects are the most important considerations and should prevail over interests of science and society. Sponsors' adverse event reporting requirements are based on GCP. The value of safety information gathering depends greatly on what information is provided and how quickly it is reported to the sponsor. Therefore, it's important that adverse event, AE, reports reflect your medical expertise and insight, and that they're accurate, complete, and reflect all relevant information. When there's a serious adverse event, an SAE, the SAE form must be submitted to the sponsor within 24 hours of awareness of the SAE. These strict timelines for reporting allow authorities to oversee patient safety information in an expedited manner. So, what is an adverse event? According to ICH-GCP, an adverse event, an AE, means any untoward medical occurrence associated with the use of a drug in humans, whether or not considered drug-related. An AE can therefore be an unfavourable and unintended sign, including an abnormal laboratory finding, symptom, or disease temporarily associated with the use of a medicinal, investigational product, whether or not considered related to the investigational product. Please take into account that pre-existing medical conditions or diseases are considered as adverse events only if they worsen after providing the informed consent. Abnormal laboratory values or test results constitute adverse events only if they induce clinical signs or symptoms, are considered clinically significant by the investigator, or require therapy. An adverse event is considered serious, a serious adverse event, an SAE, if any of the following conditions exist. 1. If it's life-threatening. An event is considered life-threatening if it is suspected that the patient is at substantial risk of dying at the time of the adverse event. And this does not include an event that, had it been more severe, might have caused death, for example, hypoglycemia. 2. If it required hospitalization or prolonged hospitalization. Hospitalization is defined as an admission into the hospital or an overnight stay. 3. If it results in a persistent or significant disability or incapacity. A disability is defined as a substantial disruption of a person's ability to conduct normal life functions. In other words, a significant, persistent, or permanent change, impairment, damage, or disruption in the patient's body function or structure, physical activities, and/or quality of life. 4. If it is associated with a congenital anomaly, a birth defect. 5. Important medical events that may not result in death, be life-threatening, or require hospitalization may be considered serious when, based upon appropriate medical judgment, they may jeopardize the patient or subject and may require medical or surgical intervention to prevent one of the outcomes listed in this definition. Examples of such medical events include allergic bronchospasm, requiring intensive treatment in an emergency room or at home, or the development of a drug dependency or drug abuse. 6. Or if it qualifies as an other medically significant event. The investigator's medical and scientific judgment is required and of particular importance in this category. These medical events may not be immediately life-threatening or result in death or hospitalization, but they may jeopardize the subject or may require an intervention. 2 types of medical events such as these are 1. A suspected transmission of an infectious agent via a medicinal product, and 2. All cases of newly diagnosed cancer should always be considered serious and assessed as medically significant in the absence of any other seriousness criteria. Adverse events are collected once the informed consent has been obtained and through the residual effect period. In other words, through the last patient contact as stated in the protocol. The residual effect period is specified in the protocol for the BI investigational product based on the pharmacokinetic and pharmacodynamic properties of the drug. Post-study reporting should occur if you become aware of a serious adverse event or an adverse event of special interest that in your judgment is relevant to the patient's conduct in the trial. Any variation to the reporting timelines will be specified in the trial protocol. The following criteria meet the standards for reporting as adverse events. 1. A pre-existing condition, indication, or concomitant disease which worsens after signed informed consent or after exposure to an investigational drug. 2. Changes in vital signs, ECG, physical examination, or laboratory test results if they are judged clinically relevant by the investigator. Markers for exacerbation and clinically relevant changes may include, but are not limited to: 1. The patient's condition becomes serious. 2. An action was taken with the trial medication. 3. Additional treatment or intervention was required. 4. Or, if in your medical judgment an exacerbation and/or clinically relevant changes have occurred. Finally, if a condition worsens after treatment, it should be reported as an exacerbation of the event or a worsening of the event on the SAE form. To assess causality, an investigator has to carefully consider: 1. The time interval between the SAE and the trial drug administration. 2. The effects of other drugs or therapeutic interventions. 3. The effect of the study indication. And 4. The effect of coexistent medical conditions. Items that may suggest no reasonable causal relationship are: 1. The temporal relationship. No plausible amount of time elapsed from exposure to the drug to the onset of the event. 2. That there is a continuation of the event despite the withdrawal of the medication. When judging this criterion, be sure to take into account the pharmacological properties of the compound. 3. That there is an alternative explanation. And 4. That there is a disappearance of the event even though the study drug treatment continues or remains unchanged. It's very important to remember the SAE reporting timelines. The paper SAE form must be completed in all of the following cases unless otherwise specified in the clinical trial protocol. 1. If there is a serious adverse event, an SAE. 2. If there is a protocol-specified adverse event of special interest, an AESI. Or 3. If there is a non-serious adverse event, an AE, if it is relevant to the SAE or AESI. All SAEs and non-serious AEs relevant to an SAE must be reported on the SAE form to the sponsor within 24 hours of awareness. A medical expert from the sponsor will then perform a medical review of the case reported and request follow-up information if required. All source documents, including medical records, must be retained at the clinical site. When filling out SAEs, be sure to: 1. Where possible, avoid leaving fields blank. Instead, use NA, not applicable, ND, not done, or none. 2. Make sure that the information provided is consistent with the data recorded in the case record form. 3. Do not attach source documents, discharge summaries, or medical records to the SAE form, but summarize all the relevant information on the form itself. Relevant information must be transcribed from the medical records onto the SAE form. If medical records are specifically requested, patient identifiers, beyond the standards required on the adverse event form, must be redacted by completely obscuring them to protect patient confidentiality. And 4. If both symptoms and diagnosis are reported on the SAE form, the diagnosis should be clearly marked. Now let's move on to pregnancy reporting. Pregnancy is not a serious adverse event, it's a normal condition. But in terms of clinical trials, the sponsor asks clinical investigators to report any pregnancy occurring in a clinical trial on the sponsor pharmacovigilance pregnancy form. The following important information should be collected and recorded on the form: maternal information, expected date of delivery, date of last menstrual period, obstetric history, other pregnancies and outcome, family history of congenital abnormalities, drug information regarding other drug exposures, including over-the-counter or herbal medicines at the time of conception, and causality. Always provide the pregnancy outcome, if known or when available. Every attempt should be made to follow up on the outcome of pregnancy. If the mother experiences an SAE during pregnancy, a pregnancy form must be completed to report the pregnancy, and the SAE should be reported using the SAE form. Some protocols require that pregnancy outcomes must be collected for women whose partners took the study medication. In this case, if the father is taking the study drug, informed consent should be obtained from the mother to collect information regarding pregnancy outcome. Any adverse event related to a drug other than the investigational drug in your trial should be reported according to your local regulatory requirements for spontaneous reporting. Now, let's summarize what was discussed during this training and outline the key points. Do not delay. Report within 24 hours of learning of an SAE. Gather as much information as possible to complete the form, but do not miss the 24-hour report deadline. An investigator signature is mandatory. Complete the causality assessment at the time of the SAE submission and based on the data available at that time. When new data becomes available, the causality must be reassessed in light of these new data. SAEs reported which do not have an investigator causality provided will be handled as suspected by the sponsor for reporting purposes to health authorities and may also trigger an investigator notification if they're not already listed in the labeling reference document. Do not fax source documents or hospital records unless specifically requested. Follow-up information must also be faxed within 24 hours. Be sure to contact the sponsor's pharmacovigilance officer as listed in the protocol. All contact details will be provided to you by the field monitor at or prior to your site initiation visit. Pharmacovigilance is critical to the pharmaceutical industry for drug approval and to promote the safe use of our products. It helps medical practitioners to enhance and communicate their knowledge in the betterment of therapeutic practices. For patients and the general public, it's the source of all drug safety information and education. Thus, in modern times, PV is a very important instrument for collection, assessment, identification, and communication of all the vital drug safety information that can help patients lead a healthy life. Thank you for attending the SimuLyve presentation, Safety Reporting of Adverse Events in Clinical Trials.